I am very grateful for having received this Lifetime Achievement Award. Honestly, it's a reflection, not for me, but of my team and all the wonderful people over the many decades now with whom I've come in contact, both researchers, basic and clinical researchers and caregivers, and most importantly, patients. You know, the reflection I would make is that I've been so privileged and lucky to understand and learn very early in my career the importance of making science count for patients. Do basic research, but make sure that there are implications for diagnosis, prognosis, and someday treatment. Number two, as a clinical researcher, to treat patients as family. If you have those two things, it really doesn't get any better than that. And so I would say, you know, coming along now as a new researcher or a young physician who's interested in academic research or research in a company, the point is here that it's an unprecedented opportunity right now to make the science count for patients. My own opinion is, in myeloma in particular and cancer more generally, there are two areas that I would just stress. The first is genomics and precision medicine. Many new discoveries are being made, and in fact, it will become more and more possible to selectively target cancer cells with single agent, but more likely combinations of targeted therapies, while at the same time having fewer side effects. The second major trend is of immune therapies. And these are even more exciting in my view because the immune system is potent, selective, and adaptable. And it's just possible that the immune system might be able to keep up with and overcome the genomic evolution that occurs in most cancers to ultimately confer resistance. Maybe someday we'll achieve minimal residual disease in cancer with a combination of these approaches, and we'll be able to have a restoration of the patient's own host immunity to keep that response durable. At that time, then we will be able to say we've really made a cure. But honestly, if I were young right now, and I'm honestly just warming up in terms of my interest and my passion and commitment to make the science count for patients, but I would be extraordinarily excited about the opportunities. If you make advances and they actually change things for patients, there honestly is no greater reward than that.